Increasingly today, we see patients with another form of, you can say, an explosion of patients with eye strain, or what is called as computer vision syndrome, pencil push-ups. The way we do normal push-ups on the ground, to strengthen our muscles, etc. The same way we can use either a sharp pencil or a pen. The principles to use are keep the screen illumination, brightness, contrast at the lowest level comfortable. Don't put it all at the maximum. Near distance, instead of going outside in the field and playing, the eyes have to accommodate. They have to focus at a near object. And that is one of the stimuli for myopia to set in and progress faster. Actually, nature designed our eyes to be hunter-gatherers. I think we've moved a long way off. Every 20 minutes for 20 seconds, look 20 feet away. That's also popularly called the 20-20-20 rule. So if there's less water in our body, there's less tears being formed. Again, dryness. If you look at a child who's looking at a television screen, it will almost be like the eyes of a crocodile. He's hardly blinking. The kid is hardly blinking because there's so much of attention grabbing.
Hello and welcome to another episode of Health for You, and I'm your host Chetna Belgare. Today, joining with me is very interesting guest, and I'm sure a lot of you will be glued in to listen to our conversation on this podcast because it is all to do with your eyes. And who do not want to know what you can do the best to keep your eye healthy? So today, joining us is Dr. Ravindra Mohan, Director of Gleneagles Eye Center and Director of Trinetra Eye Care, both of which are in Chennai. He is a very renowned doctor and a lot of information to share with you all. Thank you very much, Doctor, for joining our show.
Namaskar. Thank you, Chetna, for a very kind introduction.
Thank you, Doctor. Doctor, my first and foremost question to my guests is, if not what they are today, what would they be? Like, if you're not a doctor today, what would you have been?
Okay. Right. I think the medicine, definitely, like for many of us, medicine is as much of a calling as a profession. So the growing years, I don't have any doctors in my family. That is something that I'd like to say at the outset. So it was not some family doctors, but the physicians who were treating my family members who inspired me.
Oh, wow.
So there was I studied in an army kind of a background school. So there was some fascination with the army. But by the time I was in class 9, class 10, I had glasses, and then I thought, well, maybe I may be a misfit in the fighting forces, and then medicine remained the only calling. And over the years, it became the only calling as well.
Okay, why ophthalmology, sir? I'm quite curious to know that.
All right. I think that's a very interesting question, a very personal question also. Okay. Ophthalmologists generally are not part of the core exciting part of medicine, growing up in medicine.
Right.
In the MBBS course, it's only a short, exposure, and then, you're not saving lives. At the end of the day, all doctors want to save lives. So you don't directly save lives most of the time. But at the same time, it's one of the most beautiful specialities of the entire realm of ophthalmology, of medicine, mainly because not saving lives on one side, but making lives much more beautiful and much more worth living. So you get more to life.
Yes.
So it started fascinating me over time, and then being a little lazy as well, night duties and blood and gore also did not excite me beyond one level. And the beauty of ophthalmology, and that really had me going. And ophthalmology is known as the queen of medical specialties. We don't know who the king is. I'm sure there's a lot of information. Because it's definitely the queen of medical specialties. And there's a lot of medicine, there's a lot of surgery, and every patient who comes to us goes with some benefit of seeing us. So in that sense, it's a very fulfilling specialty. And 30 years ago, I thought it would be, and I think the journey has been extremely wonderful in that sense.
Well, I very rarely ask this question, but since it's something to do with your eyesight, like you said, every patient will go with something there. At least, if not, the vision, then at least you have a specs that you take and go because you want to see better, right? But is there any case that
Yes.
you actually can just like briefly tell us about, which has really touched you, that you were able to do this and it really helped that patient? I'm sure there must be hundreds of such cases, but any
Right.
one which you want to like just tell us about.
Right. Of course, as you said, there are so many, so many. But some of the ones, see, I am also, in addition to be a comprehensive ophthalmologist doing cataract surgery, I have a subspecialty interest and a fair amount of experience in this field of oculoplastic and orbital surgery. So all the tissues around the eye, the lids, the orbit, the muscles, those come under oculoplastic surgery. So many of the patients who come to me referred from far and wide belong to that specialty because not many people practice it. It is one of the younger specialties of ophthalmology. And in those, some of the places, the work that I have done is life-changing for those people whom I have been able to touch and do something for. So for example, one of the difficult conditions which I have operated, which remains fresh to this day, is of a young lady, a PhD scholar with what is called as myasthenia gravis, in which there is a muscle weakness and the lids were completely droopy. So she couldn't open her eyes well, and she was a PhD scholar, brilliant girl from Vellore. And nobody was willing to do any surgery for her droopy lids or ptosis because there was a risk that the eyeball may not move and she may develop exposure and all other complications. So as a relatively young ophthalmologist, I really felt for her. I felt, let me do something which I can. She's an educated person. She can come for medical care anytime. And I explaining all the limitations, I did the surgery for her in both the lids, lifted it up, and she sent me her wedding photographs.
Wow.
And it was one of the most joyous things. I did something that books tell you not to do, or books since then, books tell you to do with great caution. I put a lot of faith on her, and which of course she reciprocated. And there she was with the eyes wide open, nicely opened up, nicely closing, and married and happy. So that
Very
was
nice.
something that suddenly came to my mind as you asked me.
That's really wonderful, sir. I think this is something, I could imagine the happiness that I'm sure the patient must have been through when this whole thing happened.
Yes.
Wonderful, sir. So coming back to the, question, ophthalmology is something really vast, and I'm sure there are hundreds, like quite a few problems that patients come in with when when you're in your clinic. But today we'll probably focus on few of the commonest concerns that a lot of people write to us. Health for You is a podcast where we talk on various health issues, and one of the most questions that is most asked to us is on eye health. A lot of people do write to us on it, so we will keep it limited to few of the concerns today, because since we are short of time and all of those things, so we will discuss probably again later. But then to start off with, so what are some of the common eye problems that you are seeing people coming in with across age group? If you could just tell us some of the most common ones.
Right. If you look at my average outpatient consultation profile, I think some of the common ones include need for glasses, that is refractive error. One time it was called the bread and butter of ophthalmology because almost 70% of any population anywhere will have eye care needs, 70% of the population, out of which glasses form the first one. So that is one thing. It can be plus power, minus power, cylinder. As we get older, beyond 40 years, we get what is called as presbyopia for reading glasses. So that forms a big percentage. After that, one has things like cataract. Much less would be glaucoma, and then some of the specialty conditions of oculoplastic and orbital surgery. However, having said that, increasingly today, we see patients with another form of, you can say, an explosion of patients with eye strain, or what is called as computer vision syndrome or digital, eye strain, which is related to increasing use of devices.
Yeah,
Also closely linked. Yes.
Yes, sir. Please go ahead. I have like
Also
set
closely
questions on
linked.
those.
Yeah.
Yeah.
Also closely linked to that is the increasing incidence of myopia, which many studies have also tended to document and tended to talk about.
Yeah. So like I said, most of these are the concerns that people have written about also, like you are saying that you're seeing it in your OPD. I'm sure those are the kind of questions that are coming in. The majority of the questions that come in from parents are, first question is too much screen time really making kids nearsighted? If so, what can parents do? I mean, is that really happening, or is it just that, generally, even when I was a child, my parents would scare me saying, do not watch TV too much, you'll get glasses. So is that true? Is it like really working that way?
Right. So while in the popular folklore and popular understanding had that if you use your eyes too much and wrongly, you will get glasses, research seems to be suggesting that. Particularly with the use of devices. There have been some studies and larger studies quoting other studies and trying to look at what happens to people if they use the devices for a long period of time. Everybody is using devices.
Right.
So we cannot tell any parent today that no, don't let your child see the device, because the homework comes on the device, entertainment comes on the device, everything else. So we can't cut any child out of normal life. But there is ample evidence to suggest that increasing use leads to increasing incidence of myopia. Well, some of the evidence may not be very hard in terms of the strictness of the protocols by which studies have been done, but many studies seem to suggest that the longer you use a device, especially for young adults and children, the higher the chances of myopia. So that is one thing. That is near work. As we work at near distance, instead of going outside in the field and playing, the eyes have to accommodate. They have to focus at a near object. And that is one of the stimuli for myopia to set in and progress faster. So what is the solution to that? I mean, do we tell the children not to use, or young adults? That's absolutely out of question, particularly in the post-COVID world today. So the aim is to limit use. So the limiting the use of these devices to the average suggestion would be not more than 2 hours a day for non-work related use.
Okay.
So if somebody is looking at the homework for half an hour or 1 hour, then not more than 2 hours for other work. Would be a rough and ready kind of a suggestion.
Okay.
So continue to use the devices.
So when you're talking about device, like you said, now we are into that world of technology. There's no way that be it children, be it adults, be it even elderly for that matter. So all of us are glued to technology some or the other way, like on your phones and things like that. So there is this people who generally keep scrolling, right? When you're talking about, when you said children doing homework, sitting and staring at the computer, or sitting and looking at the television for a longer duration, or even software professionals or somebody who has work on computers, that is understandable. They are exposed to screen time a lot more than what generally we would do for recreational purposes. But this phone scrolling, does that also harm our eyes, or is it just a temporary strain?
Right. I think any form of device use would have, because it is not related to any radiations from the device. It is not related to also which device, because all the devices we are working at near. Most of them we are working, for example, in laptop we are working at about 65-70 centimeters. On a mobile phone we are working at 35-40 centimeters. So all of them make us converge and accommodate. That means the eyes have to come together in convergence, and they have to accommodate to look at near objects. So both these happen with all kind of devices. So scrolling again is a part of looking at a device. So a computer professional working 12 hours a day, or a person scrolling for many hours, and then a child looking at cartoon films for a long time, all of them virtually, in my mind, have similar kind of a stress and strain on the eye muscle system and on the eye itself.
What really happens, sir? Biologically, what really happens when you're looking at the device for a longer time?
Right. So when we look at a device, it is a near work. So, I mean, related to this is the fact that the incidence of myopia is one of the highest among the Jewish rabbi. The Jewish rabbi, the priests of the Jewish faith, who do not use artificial light. They use only natural light indoors to read their holy script, the Torah. So among the rabbi, the incidence of myopia is almost 100%. So that is because of near work under poor light conditions and the strain that comes with it. So near work itself for prolonged period of time leads to some kind of an accommodative stimulus and related stimulus for myopia. The other thing is actually nature designed our eyes to be hunter-gatherers. I think we've moved a long way off from the hunter-gatherer stage, wherein the person is outdoors hunting an animal or doing some farming, and we are not looking at near objects at all. So the eyes in their natural resting position look at infinity, look at far away. So the moment you are looking closer and closer, they are in a strained state. So the two eyes have to come together, that's convergence, and they have to adjust and adapt. The lens of the eye has to adjust and adapt to a near image, which is not its natural state. So we are in an unnatural state, the eyes are in an unnatural state most of the time today during our waking hours.
That's very interesting, sir. I didn't know this aspect of, the hunter. Yeah, it makes sense as well. It's really, really interesting. So, another commonly asked question is, this problem with dry eyes. Why is it that your eyes feel dry and tired after long periods of, work on the computer, or even generally, even if you're not really too much into phones or your gadgets or whatever, but still your eyes feel dry. Does it happen to everybody, or is it something that is a condition that happens to certain people only?
No, I think today, 30 years ago when I was training in ophthalmology, I can't recall any young person being diagnosed to have dryness of the eye, at least clinically significant dryness of the eye. Yeah. Today, every third or fourth patient coming in, especially working in the field of information technology or using computers for long, has some degree of dry eye. Now, why has it happened? What change has come through to make this a common disease, almost an epidemic of sorts? There are two things which are very important. One is the environment in which we work, and the second thing is the use of device itself. Coming to the environment, the first thing is we are working indoors. We are working in air-conditioned environment where there is a draft of wind, which almost always is drier than natural atmosphere. So dry wind, a draft of wind which blows over the front of our eye, over the cornea, taking away moisture. And prolonged periods, like 12 hours you are indoors on an air-conditioned environment, then you sit into an air-conditioned car and go to an air-conditioned bedroom. So all this will lead to dryness. Also, air conditioning reduces your thirst drive. You will yourself notice that when you are indoors, in your office, you hardly drink water because the drive to drink water is reduced. So, dehydration. So, if there's less water in our body, there's less tears being formed. Again, dryness. In addition, the working on the devices, you will note, if you look at a child who's looking at a television screen, it will almost be like the eyes of a crocodile. He's hardly blinking. The kid is hardly blinking because there's so much of attention grabbing on these devices that the blink rate reduces. And what is the aim of a blink? The aim of a blink is to resurface tears. Each time the lid moves, it takes tears and spreads it on the front surface of the cornea. So your blink rate is reduced to, let's say, to about 50%. So if somebody normally blinks 10 to 15 times a minute, your blink rate when you're using a device, concentrating on it, will be 5, 7, 10. So it reduces. Blink reduces, dry environment, reduced blinking, reduced water intake, all those are a potent and a dangerous mix to produce a dry eye state, which is extremely common today.
Is there a way to prevent it, one? And also, a little more on the blinking, like how important does blinking become? Is there something which we can consciously do?
Right. So I think blinking is a reflex, right? We never keep thinking, let me blink 5 times. So since it's a reflex, it is triggered by a dry spot on the front of our eye. The cornea, if there's a dry spot, that is what triggers a blink. So we never think about it, it's a reflex. But when we are looking at a screen, that's a pretty unphysiological type of a situation where there's something which grabs your attention and prevents you from blinking. Mm-hmm. So we have to do some degree of blink retraining.
Okay.
So if you say that every minute, if one needs to blink 15 times, one can retrain oneself. This is something I advise my patients with dryness who are working on computers for a long time. is to retrain. I mean, you keep a stopwatch and say that let me blink 15 times this minute. Let's say every 4 seconds. And then you consciously, when you're working, you can go back and retrain and blink, rather than be a slave to the physiology of, reduced blink.
That is
the
for
second
children
thing
as
is to, pardon?
This is for children as well. Anybody looking at this?
Children on the average do not spend so many hours as, let us say, an IT professional.
Yeah.
So children will they will go to school, they will come back, they'll, play for some time. So there are some things which prevent them from working for such long hours. Whereas the IT professional, somebody working on a computer is the most extreme. For children, of course, blink retraining and all will be a little more difficult for us to explain to them. But having plenty of water, because dehydration itself, so let's say 2 liters of water, one drink, so your tears are produced in adequate quantity. And for those who are indoors most of the time, to drink that as a medicine to prevent dryness of the eye. Of course, in more severe cases, we usually advise lubricants to supplement the tears that naturally are being produced.
So is there any, ideal way? I'm sorry, I'm doing too much of questions on the screen time and this thing, because I feel it's very important. That is something which, like you said, the majority of them are coming in with. So, I want to know if there is any ideal way to hold or position a phone to reduce eye strain. Is there anything of that sort?
Right. I think of the devices, in terms of eye strain itself, out of the devices, I think phone would be certainly one of the worst. 2 reasons for that. One is that the overall screen, whichever phone you use, is much smaller than a laptop or a desktop or a tab.
Right.
So there is some degree of strain associated with it. The third is that we tend to use phones in every imaginable angle, lying on a pillow with one, resting on one hand, or whereas devices generally force us to adopt a little better posture. So in all of these, I think the principles to use are keep the screen illumination, brightness, contrast at the lowest level comfortable. Don't put it all at the maximum, because that will add to the strain. The second thing, keep it at a comfortable distance, at a comfortable place. So there is the entire art of ergonomics is now coming in, where people are working in computers for long hours of how the seat should be, because not only eye strain but backache, neck pain, all those are also part of this epidemic. The device, all the parameters, keep it at less. Have some background illumination when you work. It shouldn't be a totally dark room, because then the contrast increases. And of course, along with it, the position, any odd position when you're looking at your mobile in the bed or a tab also puts some strain on the eyes, because the 2 eyes have to balance. As you know, the 2 eyes always move together, perfectly synchronized, and if there's an odd position, they have to work at that odd position. This will lead to more strain over time. And the device, parameters, the distance suggested, and the brightness and illumination, and taking a break every hour. So this is something which is routinely suggested. Get up from your seat, go take a drink of water, come back and sit. Since you can't keep getting up, people may lose their job if they keep getting up from their seats frequently. Every 20 minutes for 20 seconds, look 20 feet away. That's also popularly called the 20-20-20 rule. So without getting up from your seat, just look away from your screen. Because the eyes which are converging till now, which are accommodating till now, which are working hard, give them that little rest by looking outside your window or at the end of your room or a corner or down the corridor, wherever you can look 20 feet away. So 20-20-20 rule. You can set a memo in the beginning, later it will become second habit to you, and that will give the eyes that few seconds of rest, which will make them work well for longer periods of time.
But coming back to the other problems related to eyes, first of all, a basic question on when should somebody start going in for an eye checkup? Do they have to really wait for the symptoms, wait till all the blurring happens, the vision issues happen, or when is it at the right time to go for an eye checkup?
Right. I think so. There can be 2 ways of looking at it. The first is, when is it routinely? So without applying too much thought, one should go for an eye checkup. So that happens I think in children before they go to school, there are many recommendations which are very require much more frequent checkup. I think I wouldn't suggest that to everybody, but at the time of enrolling to school, it's a good idea to see whether the child's hearing, the child's sight, everything is fine, especially in a family with a history of myopia or any other eye ailments. The other thing, in children, right at the beginning of school and at any point of time, if the teacher is one of the best persons to guide you, because the teacher will pick up a refractive error far better and far earlier than a parent can do. Because they'll see that the child is in the back rows, can't read. Simple. The moment the teacher says that, you need to really go for an eye exam. The other clue to some kind of refractive error is the child holding the books very closely to the face. So that also suggests a refractive error. So these conditions, one should definitely go for an eye checkup. As far as adults are concerned, most of them will understand if they are not able to see well. So they should seek help at that point of time. And also if there is any headache. So all headaches, I think eye causes of headache are common and they're the easiest ones to take care of. So that is one time when you should, if you have a headache. Otherwise, around the age of 40, we undergo certain changes in the eyes, which leads to what is called as presbyopia, reading difficulty. So around 40 is a good time to get your first eye checkup if you've not had if your eyes have been perfectly fine. Otherwise, we always have pre-employment checks and things like that. So beyond that, the ideal is about every year. But, if it's less frequent also, touching base with the ophthalmologist once in a while is certainly a good idea.
Okay. So another, commonly asked question is the use of lens. Like what many people do is they do not know some of the safety measures of, using lens. So is there something which you could tell us in a very brief way on, things to take care of when you're using? Now you have different varieties of lens, right, which is used. And a lot of people now, of course, go in for laser treatments and things like that, which I want to really discuss as well. But the use of lens itself.
Right. The contact lenses have stood the test of time in terms of a great way to overcome refractive error. But despite being a great way to overcome refractive error, they also have certain risks associated with them, which is because you're putting a foreign body right on top of the eye for many hours at a time. So any contamination, any kind of a infection which goes in can be extremely dangerous and sight threatening. So even today, with all the precautions, all the developments in science, all the availability of eye care everywhere, sight threatening infections do occur with contact lenses. So the simplest thing is not to complicate it. The contact lens practitioner will tell you certain things: what solution to use, how to clean, how frequently to discard, and what not to do. In the what not to do list will be 2 or 3 very important ones. One is never sleep with the lenses in place, because the lens is an impediment to oxygen getting into the cornea, and when you're sleeping, the effect is much worse. The other thing to follow is to follow the manufacturer guidelines, right? For example, try to remove the lens once you're back home from work and use your glasses, etc. So the wearing duration, not to sleep with the lenses. And in case of any redness, irritation which is unusual, please do not use the contact lenses, because that could be a cry for help from your cornea, which is saying that, well, I'm not getting enough oxygen, I can have dangerous infections coming into me, please do not trouble me today, don't wear a contact lens. I think these would be the most important ones. And if the redness persists, please visit your eye doctor, because some of these infections can be very chronic, they can be very dangerous, and in rare cases, they can even need surgery. So,
and how often do they have to change these lenses?
No, there are different types of lenses. There are disposable ones. So since there is a lot of variation, the best advice generically is to follow the manufacturer guidelines and that of your eye care practitioner. All contact lens practitioners are not ophthalmologists, because a lot of the work on contact lenses has been done by optometrists, and they continue to play a very important role in working with ophthalmologists as eye care practitioners. So follow the advice strictly and not to stretch the guidelines to any degree at all.
Okay. So since we have spoken about most of the commonly asked questions, one is myopia, of course, and another one on the lens in the contact lenses and the care for contact lenses, and also we have discussed on the mobile screening, the mobile phone usage, and also the other devices. So coming to cataracts, why is it that some people develop cataracts earlier than others, and also is there a way to actually slow it down? Can that be done?
Yeah, that's a $1 billion question, I think, if not $1 million question. What can prevent cataract from developing? Cataracts, as we know today, are an age-related change. The common cataract. There are, of course, some less common forms of cataract, which we'll come to in a moment. The age-related form of cataract is such that by age 100, every human being has cataract. That doesn't mean that every patient needs cataract surgery, and some patients may live their whole life till old age and never have cataract surgery, because surgery for cataract is only when it comes and interferes with vision. So cataract is in some ways a physiological change, like grey hair, like wrinkles on our faces, which tells us that we are aging. So that, of course, is linked to the whole concept of aging and how we can slow down and prevent, which is, of course, a lot in the news for other reasons now. But what causes cataract? This common is age-related cataract. There is no better explanation to it. There is no prevention for it. Some families, the age-related cataract may start in the 40s or 50s. And in some, it may be starting a little later. For example, an ophthalmologist operating in a European country or in America would be operating a list of patients who would be in the 70s and 80s. In India, my surgical list would be more in the 50s and 60s. So we do tend to get cataracts about a decade earlier. There are many, theories for it: sunlight exposure, childhood dehydration due to, gastroenteritis and things like that. But suffice it to say that we do tend to get cataracts which need surgery about a decade or more earlier than the Caucasian population. So the forms of cataract which can be prevented or slowed is where, for example, the ones where steroid medicines are being given, steroid-induced cataract or cataract related to injury, and other forms of cataract. Some of the rarer forms of cataract can be reduced or prevented to some extent by preventing those conditions. But by and large, can it be prevented? No, it can't be prevented.
Okay. So for majority of them, normally what happens in Indian population is they wait and wait and wait till they really have the trouble in seeing, and that's when they actually come in for surgery, right? Majority of them, from what I've known of. But is that suggested, or when do they actually have to, get it operated? Is it very important to get it operated, or is it only for the sake of life ease of life, where they can actually see better and quality of life and things like that?
Right. So I think the whole concept of surgery for cataract is to improve the person's vision, and the visual needs of each individual are different. For example, a pilot will come and insist on early surgery because she or he cannot work normally with so many dials, working in the dark, and it would be disastrous to be working even when has a trace of cataract. But somebody who's a farmer and whose life doesn't really depend on that kind of vision would be perfectly justified in delaying the surgery till he or she finds it difficult to carry out activities of daily living. So the timing of surgery should be dependent on those factors, and not on the age of the patient, for example, or the density of the cataract. Of course, there are cataracts in which the patient can't see anything. We still operate patients whose vision is almost nil, and they've waited long enough because God has given us two eyes. So if one eye is working, the other eye, patients tend to wait. Rarely, I may tend to reassure most patients, of course it is not to reassure everyone, that most of the cases the cataract does not burst. Suddenly it bursts and things like that. That's one way in which doctors generally tend to warn the patient that please don't wait till the cataract becomes so hard that the routine stitchless safe operation that we do in 15 minutes becomes a prolonged operation with more complications, more operative time, And rarely some sight-threatening complications do happen even with cataract surgery. So operating it at the right time without waiting for long is important from that point of view.
Okay. So can diabetes related, because many of them do not know that diabetes can actually can damage their eyesight. Many people still do not know. There is a lot of awareness to be created. One, how can that, how is, have you been seeing patients coming in with diabetes related eye damage, and can it actually be reversed?
I think diabetes, India is now widely known and well known as the diabetes capital of the world. And the recommendations for screening for diabetes are fairly clear. Most of the patients would have type 2 diabetes. That is basically the adult onset diabetes, where there is no catastrophic sudden event which calls us to attention. Unlike the type 1 diabetes which young individuals have, wherein suddenly the patient will fall sick, will have some fever or some other problem which brings attention to the fact that the child has diabetes. The adult onset diabetes is a slow incidence. It may be there with, in a person for weeks, months, years before it's picked up. So the standard recommendation is to have a complete eye examination at diagnosis, at which time itself one may find that there are changes of diabetic retinopathy. So screening should be done at diagnosis and ideally every year thereafter. Sometimes this every year business is sometimes a little hard to follow up. If you insist on 1 year, at least they'll get it done every 2 years, or if not every 2 years, every 3 years. But even today, in my practice, in a big city, I find patients who've been diabetic for 10 years, never had an eye test, because they claim, rightly or wrongly, that they've never been told by the doctor to get an eye test done. And when you look at the eye, there are irreparable, changes which can affect the long-term outcome of their vision. So, once at diagnosis and every year thereafter. If there are any changes of diabetic retinopathy, every 3 months or 6 months, as your doctor tells you to. So, it's very, very important to screen.
And that can be reversed? And that could.
At some early stages, right? I mean, that's a very good question, because in the very early stages, when we first pick up the finest changes on magnification, when we look at a patient on a slit lamp, those changes are also known to be reversed if the control comes. So we tell our patients, look, you've come at a time when things can be reversed, please go ahead, straighten out things, and we sometimes see that those changes have reversed and definitely not progress. So these diabetic retinopathy changes are related to two things. One, the severity of diabetes, and two, the duration. The duration you can't do much, right? Somebody gets it at 50 years, can't reverse that. So at 50 years and the person is living, let's say, to the age of 85, so it's 35 years. In those 35 years, how well you control diabetes is very clearly related to the severity of diabetic retinopathy.
Oh.
So what you can't control, you can't. But what you can control is the control of diabetes overall, and that certainly has been proved beyond reasonable doubt to be the single most important factor in preventing more severe forms of diabetic retinopathy.
Sir, ophthalmology has kind of advanced rapidly in recent years, especially in India. We've been seeing that there are several new techniques that has come, and from the smallest, like the cataract operation, which is to take a longer duration, we have reduced it to such short time and all that. So what are some of the biggest breakthroughs in eye care and treatment that have improved patient outcomes now?
So there are quite a few, but the most important ones are, especially for the Indian population, when we look at it from the India point of view, where we are possibly the leaders in taking surgery to the communities. Because there is no point of doing surgery only in the big cities and in a few centers, because this is a disease, this is a condition which affects everyone, whether it's a humble farmer or somebody living in a city. So the lot of development has been there in the delivery of services rather than in the actual technology. Some of the actual technology has been invented abroad. We still are not yet there in inventing new techniques, but the way we have embraced technology and innovated in delivery, like we famously talk about the Arvind Eye Hospital model of the base camp approach. I mean, even as a resident in ophthalmology, we used to go out and do camps, surgical camps, in small villages, in a school which is, sanitized for that purpose, and all the patients come there. But that has been now given up for a base hospital approach, which is safer, more efficient, and vans to bring the patient, and then different funding models so that patients don't have to pay anything. And all patients today undergo surgery with an intraocular lens, because we've started manufacturing intraocular lenses in the country. That drives down the cost. So the surgery that a rich person has with all the means at his or her disposal is not very different from what the poorest of the poor today have. So I think that's a phenomenal achievement in any field of medicine anywhere in the world. So that is one aspect that I wanted to emphasize. The second is in the management of diabetic retinopathy. Advanced diabetic retinopathy was virtually signing a death sentence for the patient's vision, and thereby for his or her active productive life. But there have been certain injections which are placed in and which reverse some of these changes. So these are some of the two very, very important, one in delivery and of eye care, the models that exist today, and the other one in, for example, in the management of widespread condition of diabetic retinopathy, which is saving sight like very few things have done before.
So another commonly, that I've been hearing a lot is this oculoplastic surgery. So what exactly is this? It's a subspecialty in eye care is what I know, but then what exactly is it, and what are the kind of condition it treats, and why is it becoming so popular?
Right. So oculoplastic surgery is my own subspecialty interest. So it's something that fascinates me beyond everything. Oculoplastic surgery is surgery to correct any abnormal appearance of the eyes, right? The eyes have been spoken about so much in the literature, in poetry, in art, so you will find so much on the eyes. So even the slightest abnormality around the eye, for example, one lid is droopy, there's nobody who will miss it, because when we meet a person for the first time, 70% of our eye tracking studies have shown that 70% of the time we are going to look at the triangle made by the two eyes and the nose. So if there's a slight droop, a scar, a blemish, it will be picked up. One could have any big scar on the back of one's head and nobody will ever see it. So the importance in terms of recognizing, in terms of being picked up. So it's an abnormality, and nobody wants to associate with somebody with an abnormality. This is hardwired into our brain. So it is not we are malicious, right? So that is one thing. So that makes it important. A child has a droopy lid, for example, both the eyes are droopy. Now that child will be thought of as being unintelligent or dull or lazy. So in the long and competitive race of life, marriage, relationships, jobs, it's going to affect. And as a surgeon, if I can set it right and correct it, that's one of the most fascinating aspects of my work. Or there is thyroid eye disease, you must have seen pictures or patients with bulgy eyes. They get looked at like horror figures. Even in movies, you see them as horror figures. So if we can put that eye back into the orbit by doing surgery, that's absolutely fascinating way in which we can help patients in complex ways.
And these surgeries are generally safer?
Yes, they are quite safe. Of course, they need years of training, years of work, and extremely careful surgery. And some of the surgeries have significant side effects or limitations, which we discuss with patients over many sessions. But having said that, most of these operations are very severe, very safe, and even done in neonates. For example, I did a surgery, orbital surgery, for a child who was just about 28 days old, and the child was diagnosed to have an orbital tumor in utero during an ultrasound scan, when the baby was still in the mother's tummy. So today the safety index in experienced hands, all these operations are quite safe.
So like you said, eye is something which first thing that we notice as well, like when you're talking. Are there any general observations that through the look, when you look at the eye, you get an idea of other health problems? Has there been any if you can just list few of them, where you've seen the eye and say that this is an indication of some other disease?
Oh, yes. So, one of the popular expressions that I really love is the eyes are windows to our soul. I mean, so I paraphrase it as the eyes are windows to our health.
Right.
Because when we look at the eyes, if there is a patient is very pale, a person is paler, we pick it up. If the person is jaundice, we pick it up. If the person has some neurological issues like a tumor in the brain, some stroke, then the eye movements and subtle changes, if observed, can give us a clue as to where the problem is. So we help the neurologists and neurosurgeons a great deal by teamwork in terms of looking at the eyes. Thyroid eye disease, I mentioned, bulgy eyes, staring appearance. In addition, when we peep inside the eye, development of cataract at an early age, different types of cataracts, which may indicate certain other conditions like kidney disease. And when we look at the retina, the curtain behind the eye, diabetic retinopathy, high blood pressure, and some tumor inside the brain. So all these can be seen by looking at the eye. So in that sense, they are a window to our health. And as an ophthalmologist, I'm also always very, very happy to help other team members. It's always very exciting, even at this stage, to pick up something and help my colleagues in other specialties and say, look, this is a fungus infection of the eye. I find the tiniest evidence of it much before the blood shows the fungus. So these kind of things make multi-specialty work very exciting, and we do contribute a lot to the overall management of the patient.
So now I have some set of questions which are true or false. I mean, you need to tell me if it's true. If it's false, you can say it's false. And then if you could briefly give us the reasons as to why it's true or false. The first and foremost, which I've been hearing from my childhood days as well, is eating carrots can improve your eyesight.
Sure. The active ingredient in carrots is beta carotene, which is a precursor of vitamin A. And vitamin A is absolutely essential for normal sight because they are involved in the visual pigment. So if somebody's got vitamin A deficiency, night blindness, not being able to see in dark is one of the first subtle signs of vitamin A deficiency. So eating more is not going to help, but if you eat, you have adequate amounts of vitamin A and it's good for the eyes.
Absolutely. Are there any other foods, sir? Any other food that you think that can actually help in eye health?
Oh yeah, the vitamin A is there in fruits like papaya, also in all the green leafy vegetables, which go by different names in different places, but Indians overall in our traditional diet have a lot of green leafy vegetables throughout the year, different ones, and they are also extremely good for sight.
Okay. So reading in dim light damages your eyes, is that true or false?
Yes, reading in dim light essentially makes one look closely at a thing also. When the light is dim, you would like to keep the book or whatever else you are using at a closer distance, which stimulates more of convergence and more of accommodation. That is, both are stimuli for eye strain and progression of myopia. So reading in dim light, youngsters actually get away with it. One of the observations is that, as we get older, we need brighter light. So we'll always have the grandparents scolding the grandchildren as to why they are working in dim light. But our retinal thresholds change with time. So within limits, reading in dim light is not definitely good for one's eyes.
Wearing glasses too much makes your eyes weaker.
So, I mean, that is a common one. And so you need to wear glasses for two reasons. One, to be able to see well, and the other one is to prevent things like headache or eye strain. So if the glasses are serving one of the two purposes, you have to wear them. And wearing glasses does not make the myopia worse or the reading issue worse. What actually happens is, in today's understanding, if you do not wear myopic correction properly, then that blurring that happens in the image can itself be a stimulus for more progression of myopia. So in fact, today I think we should reverse it and say that not wearing glasses may be bad for your eyes, in a manner of speaking.
So now it's summer and there is a lot of discussion about heat wave, and there are many warnings that are given and all that. So do you think sunglasses to be worn or not worn? What is the what is your advice? Like, do you suggest wearing of sunglasses, or whether UV rays can really harm your eyes? What happens?
Yes, sunglasses, I mean, routine glasses also cut off UV rays actually.
Okay.
So the dark glasses cut off the visible part of the spectrum. There's one argument which says that actually when you wear dark glasses, the pupils actually dilate because it's a little dark, and so more UV rays may enter the eye. But I think the argument against it is that most of the UV rays don't cross our cornea, they don't cross our lens and get into our retina. So wearing dark glasses is certainly recommended, but there is prima facie there is nothing wrong in wearing dark glasses in terms of any progression of disease or causing any other issues as such.
Okay. So glaucoma only affects old people. Is that true?
No. There are variants of glaucoma which start early, which we call it as, by birth. There are children who develop glaucoma from the womb and they have glaucoma at birth. Of course, that is uncommon, but it is still there. Youngsters may develop, some forms of developmental glaucoma, and some forms of glaucoma can come in earlier. So the statement is partially correct in the sense that we need to screen and look for glaucoma in overall, if you want one figure, over the age of 40. But there are forms of glaucoma, especially if there is a family history of glaucoma, where patients should be screened even at an earlier age to be able to pick up. Because as we know, glaucoma is a sight-threatening, blinding disease, which we have to prevent at all costs by delivering medical care and ophthalmic care.
Right. So this use of these drops for dry eyes, or I wanted to ask you another question on pink eye and lazy eye, which I kind of missed asking you. But before I ask that, the use of these drops, the refresh tears and things like that, is it safe generally, or what is your suggestion on that?
I think these drops, I wouldn't take any names for
Sorry, yeah. Right.
for not being supporting any particular brand, but the use of lubricant eye drops of the common variety is now an over the counter. These have now become over the counter drugs. I mean, after having been tested for a long time, so they are safe. They are quite safe, but they are not the solution to all the problems. So if the problem persists despite using a lubricant, one should meet an eye doctor.
Okay.
Otherwise, it's pretty safe to use them.
Okay. So what is this pink? I mean, again, that's another thing which we commonly hear is the pink eye. And there is another condition called as lazy eye. If you can just tell us what are these?
Yeah. So lazy eye essentially is that an eye. So, in nature, whatever is weaker will get suppressed. I think that is also true for our body, wherein of the two eyes, one eye is better. That will dominate over the eye which is weaker, and that doesn't develop. So there's an age to which vision develops, and the brain develops that part of the vision. That eye develops vision to its fullest extent up to a particular age. For example, there's a child with one eye perfectly normal and the other eye has, let's say, a +4 or a +6 power, which can almost never be picked up without screening. And that weak eye remains weak and doesn't develop vision. And after one age, even if we correct it, the vision will not come back. So that's called a lazy eye. So if there is a little squint, and the squinting eye will become a lazy eye. If there is a power of glasses, the worse eye may become lazy eye. Or if both the eyes are weak, both can be lazy. So screening, as we mentioned, at the time of going to school or preschool, where there is still a window of opportunity. The interesting part is that lazy eye can be made active by methods like blocking the normal eye and forcing the lazy eye to cope up and to shape up. So that lazy eye can be treated within a window of age. So let's say up to 6 years very well, and maybe up to 10-12 years one can certainly try to tackle that. But beyond that, no, it remains lazy.
What about the pink eye, sir?
Pink eye, yes. The pink eye is actually what we call it as conjunctivitis. I think in Indian situation, everybody calls it as a red eye or conjunctivitis. And there are local names, Madras eye, not because it is seen more in Madras, but the Institute of Ophthalmology here, which was one of the earliest, which is the second oldest institution in the world after Moorfields Eye Hospital. So there was a lot of work on this infection, eye infection, virus infection here. So that's why it's also called the Madras eye. This is usually seen in an epidemic form, wherever there is, breakdown of hygiene. So, basically it will get transmitted from the infected person's tears onto his or her hands, or a handkerchief or a towel, and then the second person who gets infected gets that into the eye by direct contact. So unlike the common myth, you don't get it by looking at somebody, etc., but only through direct transmission by the fluids, that is the tears. So the main thing to do is to, not touch your eye after you've gone out somewhere, because you don't know who is carrying that virus, and if you go to a mall, if you go to a railway station, airport, so it's a good idea not to keep touching your eyes. Or if you want to touch, you feel the urge to touch, wash your hands with soap and water, and then you are very safe, because all these viruses are very sensitive. They can't stand, washing with soap and water. Yeah. So if somebody in the family has it, to keep the handkerchief, the towel and all those things separate and not mix it up, because those fluids can get transmitted from one person to the other. Right. And so those are the basic precautions we...
Okay. So I have one last question. Are there any exercises at all for the eye health? If you can show us a few, one or two of them, if there is.
Yeah. So one common problem is weakness or deficiency of convergence. Now, convergence is when we look at something near, then the eyes come closer to each other. What we call it as the squinting. We all squint, right, to see something. So when we have convergence insufficiency and we are working hours and hours on a computer, laptop, reading, studying, most of our work is actually, very close to us.
Correct.
Most of us are, as we mentioned earlier, not hunter-gatherers, or we're not, shooters and things like that. So if there is convergence insufficiency, that means our convergence is not adequate, then we will develop eye strain, because the eyes which converge, they don't converge enough, and then the convergence breaks, and then you again strain. So this goes on for hours and hours, and at the end of the day, you find letters running into each other or strain, and you don't want to look at the laptop, you don't want to look at the book. So that is convergence insufficiency. So the good exercise for that is what is called as a pencil push-ups. The way we do normal push-ups on the ground, to strengthen our muscles, etc. The same way we can use either a sharp pencil or a pen and keep it at about an arm's length and bring it slowly closer, looking at the tip till it blurs off. Where it blurs, we hold it and converge our eyes. In Tamil they say, Ottu paakano, you look, squinting at it. And we can all squint when we want to, right?
Right.
It becomes clear. Then again we take it away, bring it closer. The moment it blurs, again we squint and make it clear. We do that 10 times a day in the morning. When you rested, you had a good night's sleep, you have your bed tea or bed coffee. So we can do it outdoors, in the terrace, in the garden, or on the, in the balcony or somewhere. So that makes our eyes converge better, and within a week or two, one will find a huge difference in the eye strain by doing this, what is called as a pencil push-ups or convergence exercises.
Oh, very nice, very interesting, sir. Thank you very much. I think it was wonderful speaking to you, sir. It was a lot of information, especially for all of you who've asked me about questions on how do we use the device, how many hours do we use it. I think we've answered most of the questions that was asked to me. It was really wonderful having you on the show, Dr. Ravindra. Thanks a lot.
Thank you very much.